So why don't we get started? Let's start with introductions. Welcome everyone to the Program and Grants Committee on October 28th. How is that possible? And I'll start with you, Chastity.
Everyone, Chastity Toole, she, her pronouns. I'm the executive director for the Maine Recovery Council.
Thank you, Tess.
Hi everyone, I'm Tess Parks. I use she, her pronouns. I'm the vice chair of the Maine Recovery Council, and I was appointed as someone impacted by substance use disorder.
Thank you, Pat.
Good afternoon. My name is Pat Kimball, and I am the chair of the Maine Recovery Council. Welcome, everyone.
Liz.
Hi, Liz Blackwell Moore, she, her pronouns. I'm the director of Cumberland County Public Health.
Thank you. Elizabeth.
Hi, I am Elizabeth Fortier. I am the coordinator of the Maine Recovery Council.
Thank you, Grayson.
Hi, my name is Grayson Havens. I use they, them pronouns, and I'm with the Attorney General's office.
Maggie.
Hello, everyone. I'm Maggie McLaughlin. I am a member of the MRC representing the litigating subdivisions. Happy to be here.
Thank you. And I'm Joe Everett, the president and CEO of the Opportunity Alliance here in South Portland, and I chair this committee, and I am a member of the full council. So welcome, everyone. So I thought we could start off by getting an update, Chastity, about the where we've landed with the and maybe I've missed it. I was on vacation, so we may have got an email about the grants management RFP process.
You have not missed it. Nothing's been sent out to anybody yet. It's in the Attorney General's office while they review to make sure we've covered all our bases with the process. So to be continued.
Okay. Thank you. So why don't we keep going with other contracts and grants, Chastity and team, if you want to update us or any assistance we can help with.
From the last council meeting, as far as contracts, there's not a ton of change. We have two that won't happen until the beginning of the year that we're waiting on, York and the Recovery High School. And there was a few amendments that we're working on, but as far as that's it. There's not a lot there, which thankfully, because that's been going forever and a day, it feels like. On that, you're going to get in this to the next one. Now it's in the reporting side, and we're starting to get in some of the first reporting stuff, and that is now the new overwhelm. One, like the sheer amount of it, and without having any sort of platform. Like it's Google Form, or not even Google Sheets, not even forms. So one, a lot to go through, and two, not streamlined. So I want to say, just for anyone who's listening, grantees will get an email about this too. When people send in their reporting to us, please don't send identifiable information. That's happened with some of the reporting. Like, it was kind of shocking opening it and seeing like participant information that we shouldn't have, especially since anything we have it becomes a public document.
So we can, and I don't know. Oh, go ahead, Maggie. Oh, you're on mute. Yeah. And then Pat.
Chastity, that's a great point you just raised. I wonder if there's some protocols we can engage around how we handle FOA requests, because typically, I know at the city level, we can protect confidential like PII information through, the laws work in concert on that front. So maybe we can look into how we can make sure if somebody were to FOA something that was sent to us by accident, that we make sure that it's blacked out and redacted for that type of thing.
Yeah, the AG's office would do that, but still, like, even Elizabeth and I shouldn't see some of that information.
Pat.
So Jesse, I have a question. So, do you have, I know that you don't have your calculating results, but are all of the grantees that are required at this point, have they sent in their information, or is there still people that have not reported back to you?
There's a handful that haven't. We gave a couple of extensions. Some people requested a bit before the deadline, and then there were some personal family emergencies and things like that, very last minute, that we kind of have some floating deadlines with people just as they deal with those things. And so I think with this first batch, we're trying to be a little bit more flexible just because it's helping us to establish those processes. But my goal is to go through that hopefully by tomorrow and send reminders to those who haven't submitted, just because I think they also, even though it is stated in their contract, there may just have been some confusion about when those are due, just because I think anybody with like state reporting may just be used to end of the month deadlines. So I don't think we're too worried about it now, but do just want to send reminders before it gets too far out from that deadline.
Thank you.
So I'm having kind of a real so what moment with all this reporting. So, what's the role of the council? What's, can we kind of talk that through? And maybe again, I'm just dense and I'm not following it properly, but I think it's a lot of work for grantees. So like, what are the highlights that we would want to raise up to the council? And do we have that roadmap, Pat and Chastity, sort of, so to speak? And any ideas we have around that? Because you're gonna already have to synthesize it because we don't have a platform, but just can we kind of dive into that conversation a bit?
So, and please, Chastity, jump in. So what we've discovered is, in some cases, we've probably asked for more information than we ever really wanted to have. In the next round, we will probably summarize that much better than what we did this first round. For me, I think the council really needs to concentrate on, are they spending the money as requested, and also a financial to make sure that the money is there and that they're spending it according to that. But and if there's a surplus, why is there a surplus? Those kinds of questions. But again, we don't really have a formal process, and I think we should discuss that. I mean, the budget part, the financial part should probably actually go to, that review should probably go to Finance Committee, is my guess. If there are concerns about budgets and how that worked out, go through there. But I think we need to get together and really do we need to have our own form as to what we're reporting back to the council. And to be able to have it such that we can track it and see if there's progress and know different things like, I don't even think we've actually discussed what is our results. Do we want to know how many people are served? Do we want to know? I mean, we don't even have that laid out unless Chastity has it somewhere and I don't know. But the problem was when we sent out the grants, rather than have a standardized form, it can somehow, it goes sometimes with the project, which makes it hard to compare data. But Chastity can probably answer this better than me.
Sort of, but also not, because I feel like this also leads into what we asked last time is, what do you guys want brought to the council as far as reporting? So it's a both, either side. So what we have right now, it's not a blanket, like X people served. It's every approved use has different deliverables like in it. And that's the night. Elizabeth, will you pull up the template and show them what the template looks like? Because it's a catch-all. So everyone gets the same template, and then when you see the Exhibit E, it lists every approved use and deliverables for that use. And each one is different. And this is where, like, if we got something and people could report that way, then it would be easier to pull for reports for you guys and just going through it to see all of it. So this is where they pull it out and actually report, but when you go to the Exhibit E, like this is the nightmare of the different pieces where there's so much. And our contracts, some contracts have 1 or 2 approved uses, some have 10. So there's duplicate measures. We've told them don't do duplicate ones. So this is where hearing what you guys want helps us pull back a lot of this also. And in the absence of contract management, if people know like good software programs, let us know to look into it so we can get that going for us either way, because I think we need it either way.
Cassidy, do you think that the Moss Center, where they're research based, could help us develop standardized reporting for the council on the projects?
Hopefully it's one Elizabeth and I met last week, and that was one of our things
Oh, good.
to reach out to see how to work this down in a more manageable way.
Because they're researchers, it's what they do. So I was thinking they could help us make this more manageable.
But with that, with Moss, that also, I don't know the answer, may require some more funds from us too. Like I know they're funded by the AG for stuff, but I don't know necessarily that they'd have the funding and capacity to just take this on for us without extra money.
Test it. Go ahead, Tess.
Yeah, thanks, Joe. Pat, I was also thinking about the Moss Center, and I apologize if maybe we've covered this before, but in terms of the information that we're collecting, or is any of our outcome data going to go towards the Moss online database that they're building for the subdivisions? Because I know, I believe in January is when the subdivisions are required to report to the AG what they've spent their money on. And I know Moss is working on a form. So I was just curious, are we going to be contributing to any of that outcome data for the public?
I don't know the mechanism yet, but I believe that was the intent that ours all would. And I don't know if it will come direct from us or filter through the AG, but yes.
I mean, I think I've said this before. It doesn't make any sense. If the Moss Center is going to evaluate the opiate settlement dollars, they don't include the data from the council. They're missing 50% of the money and the impact that those funds could have. So it's a huge gap if we don't somehow coordinate with them, that if they just report on the municipalities and the schools or whatever, it's certainly not going to show the public the impact of the dollars where the council has 50% of those funds going out. So we should probably somehow figure out a way to coordinate with them that.
Definitely. Liz.
Yeah, I mean, it seems like they would do it if we pay them. Like, I think they were probably waiting for us to decide what we were gonna do. And I do think that it's hard for me to say, Chastity, like that question of like, what do you want? What do we want you to pull when I haven't seen that, like all the things that are possibly being submitted. And it does feel like that is a great job for somebody who's like an evaluator and can say, this is how we can make sense of the data that you've collected and that people are collecting. And actually, there are some things where if these three organizations collected this instead of that, then it can be more, it makes more sense that way. I just feel like we can't, it's like, I think it's an impossible task for us to tell you without some of us sitting down and looking through all the things that you've gotten, which really feels like we should, like, that's maybe not a great council project because we might not have the expertise to do that. So I'm a fan of if our contract management person that or group that we hire isn't going to do that, because that's more of like process evaluation, not evaluation, like outcome evaluation, then I would think we should consider hiring Moss and paying actual funds for them to look at our data, categorize it for us, and really do a better job of understanding what are the outcomes we're getting.
Yeah, I agree, Liz. I think that um, the council was selected, I think, because of our knowledge and some people's expertise in the field, not to be statisticians and data analysts people. That's not our core competencies for all of us. And I hear at TOA we use RBA, results-based accountability. And for me, I want to know how much did we do? How well did we do it? I think it's really important if this is a ton of money and is anyone better off? And I think that's what the public want to know. So I think that, and Moss is amazing. We've heard from those folks. I would agree with Liz. I think we need to pay them and get in sync with AG's office. But I think organizing it around, I just love those buckets because I think it resonates with people. But if we could have it organized in a way that's digestible, and so that's one aspect. And then Pat, where you started, I want to go back to kind of compliance or adherence. So, like, is that the staff's job? Does that come to this committee? Like, if someone's really, I'm trying to think of us like the TOA board. It probably wouldn't go to the full board if we were making a grant or receiving a grant. It would go to like this committee of the board. So, Chastity, what are your thoughts around that? Just in how can you give us back of the napkin how people are doing? I know people are underspending because we all understand startups, but are there any other like kind of themes that you're seeing as these grants get off the ground as it relates to sort of compliance and adherence to their proposals?
Elizabeth's been digging into it more than I since it's been coming in. Um, Underspending, I also like across the board, it feels like people are also overly cautious on can we do this? Can we do that? And like it feels like there's been a lot of delay just in that. Like every
Mhm.
time someone has to change a budget and there needs to be an amendment, like that feels like such a big time suck, like just to move the budget lines around. And I feel like that is the biggest piece so far is people asking questions and not wanting to use it wrong more than overspending or not being able to spend. And then the being able to hire and delayed projects, that's an ongoing issue with everyone.
So if I sort of see two two sides of this coin and who we want to be. So if TOA received a grant from the Cohen Foundation or John T. Gorman or some foundation, and we were doing exactly what you just said, we would like get a hold of them. They also have, more probably staff to respond to those things. And then they would likely say, can you just write something? You organize it in writing and send it to us. So that's one possible place. That's one personality we can be, or one organization, or we can be government, where it's sort of like a little bit of the you will, you will, you will. So who are we to that? You know what I'm saying? Like I want us to be more like a foundation where like we want to be innovative and we really want to get to root causes. So, but I
I
think
can
that
say, sorry, I'm going to
go
interrupt you
ahead.
on it.
No, go ahead. Keep going. No, this
Our
is good.
responses have been I think, Elizabeth, tell me if I'm wrong, very flexible with people
Great.
and not rigid unless it's something we can't be.
Yeah.
Where the state still holds our money and we have, those things. So as long as we have the flexibility, we've been very flexible with people.
That's great. And I'm not all not bashing state government. They have a lot of, just like organizations do, we have a lot of compliance. So I think, but the more we can be what you just described, Chassis is great, I think, in terms of helping people um, to use their money. Pat,
And I like the fact that, again, we don't want to be too rigid. We want to be flexible. And I know that if some of the questions are budget, we may want to next time be able to say to people that if they change the budget by a certain percentage, they don't need to contact us. But if it's above or below a certain percentage, then they really need to submit a change. It also needs to say somehow you can't change the mission of your project. You can't decide that if you were doing widgets, you can't all of a sudden do something else. So as long as you were staying within the mission of your project, but you're changing one of the salary lines by 10% to purchase something else, they should be able to have that flexibility without every nickel and dime coming to us. But above a certain percentage, they should be sending us an explanation as to why they want to change a budget. And I think they're used to that kind of thing. The state contracts used to include, if it was above and below a certain percentage, you need to report that before you spend it.
Right.
But again, if the mission changes, then that certainly needs to go for full approval. But somehow next time around, we may want to look at that and bring that to finance about what would be reasonable in those budgets, because you don't want to be nickel and dime every time they change a line in a budget.
Exactly. Good point. So Chassis and Elizabeth, what do you need from this committee? So it sounds like the Moss Center, an idea. Do we need to do any proposing, and is there anything we need to do in writing to get them going? And sorry if I don't know this, the grants management successful bidder, what will they be doing a piece of this? But just like, what do you need from us to sort of keep this moving forward?
I don't know if we need anything as far as Moss yet, thinking about that. I think we'd need to go to them, get a proposal before we need anything from the group. And that would just be voting if we have to spend money, if that's what we want. So we'll get a proposal to bring back. And on what the other piece is going to do, I guess we're still figuring it out.
Well, there's a lot of expertise on this call. So Tess, Liz, Maggie, what are your thoughts around kind of this piece of it? Sort of like getting Moss or the successful bidder. Like agree a proposal, but like what at the end of the day, what's our result? What are we wanting out of this? So any wisdom from the group in your day jobs?
Well, no, I guess I'll say we've been working with them on our own opioid settlement dollars that we have been using at the county. And they have like a lot of expertise and they've been super helpful in because we have like kind of a complex project that we're doing. It's around coordination and it's a complex project. And so we're really looking to them to help us. We've been making a logic model and coming up with like our very clear outcome evaluation tools and metrics for how we're going to assess the success of this. And I feel like if we have somebody who's going to be doing some of the process measures, like that's what that grant management is going to do. I think what we really need them to do is help us figure out how to take all this information and figure out what are the outcome measures that are most important for us to be asking of, like, look at it and come up with some key outcome measures that we could be making sure everybody is tracking. Because there are process measures that we might want to have to say, are they doing what they said they were going to do, right? Like, but those might not be the things that get reported out to the public or to the council. And we don't know what those are right now. And to me, that's what you'd want the Mass Center to say is, these are the 10 metrics that we want to make sure we're capturing that are most easily connected to one another between these projects that could be reported as outcome measures. Here's the impact that this is having. And I think that's what they will be really good at. Is that what you mean, Joe? Like, what is the
Yeah, that's
thing you
perfect.
want? I
Perfect.
think
Yeah.
it's like being clear with them. It's about outcomes. Like, we really need you to help us address, are we having the impact? Not, are these organizations doing the things they said they do? That you're
Right.
going to collect. We know that. So that's what I would say is kind of the difference.
That's great.
Agree. And again, the Moss Center can do that. And I think that if Chastity and Elizabeth talk to the Moss Center, I think they can tell you and put a proposal together for us that we can look at. And if we think it's the proposal is good, we can actually have the Moss Center come to programs and grants, or we can just take the proposal to the full council to look at to see how it is. But I agree with Liz. I think that's the best way to approach it.
Great. Maggie.
I agree with what's been said. I would just say, I want to flag in, I think the nature of the work that we do really lends itself more to catalyzing than to direct impact. And because of that, we likely want to have a combo approach where we would have maybe some standard outcome indicators and those kind of prepackaged with income reference sheets that people can understand how that feeds into, and we can manage quality control on those, which are going to be more quantitative. And then pair it with a set of case studies that relate to catalytic impact, which wouldn't be capturable without really diving in and looking at indirect impacts. Because the MRC invested in XYZ, then we saw this follow-on impact at that community with additional resources, or they were then able to access this or expand their certifications to get to this, which led to a reimbursement model, which led to sustainability, all those types of tracing the line. I think that's going to be really important for the story that we tell. And so I would just flag at this stage, as we're thinking about what is the impact measurement, that those case studies are going to be key.
That's great. Tess.
Thanks, Joe. Yeah, because I was just thinking the bill that we had passed requiring transparency only requires the uses, not necessarily the impact. And I think like the day-to-day that I see in my job, there are smaller communities and counties that are maybe using a significant portion of their funds on certain items. And I think we could really be leaders in terms of painting a broader story and picture of many different uses and the impacts that they have to maybe inspire other decision makers to look beyond maybe a few limited uses that we see over and over again. So I'm really excited to see what impact data will come for all of the grants that we've awarded to show, there's many different uses, and other communities should consider that when they're making their own funding decisions.
That's great too. Okay, Chastity and Elizabeth, you have what you need in this lane?
For now, when I have questions, I will ask, don't you worry.
No, I know. That's good. I mean, this is complicated. This is where it's getting into the meat of things. So, and we'll bring it back. But yeah, I think the Moss Center, to what we've talked about, it really have a lot of capacity. Okay, so moving right along, I'm going to jump over the community needs assessment because I know we want to talk a little bit about the SSPs and harm reduction, Chastity. Anything you need from the group with that work after the last council meeting?
The SSPs, yeah.
Yeah.
Hold, please. Oh, hold on. I gotta get a form here. Um, it's not letting, hold on. Okay. So this was what I showed you at the last council meeting to give the breakdown of the SSPs and how they receive money from us so far. And in talking to the CDC and in the way this all breaks down, there's a couple options that I put together. I know you wanted a single recommendation. There's two. The choice is still going to be yours, but I'll explain them. There's reasons for it, so it depends on which way you want to go. So in the two options, either way, it's still the same amount of money. Both options, no matter what, has Coastal Recovery Community Center getting the 75,000 that was kind of like our standard to SSPs for a year. They are the only one who isn't receiving money from us in any capacity, whether the SSP bucket or our grant making bucket. And in talking to the CDC, the only recommendations that they gave me was please fund Coastal and please give Spurwink some more money for Lewiston with Cozy's closure. So the first option has Coastal getting 75, MIRAP getting 75,000. MIRAP is the only organization that offers syringe service programming that doesn't get specific SSP money from us. They got money from us for the Access Center, not specific to the SSP. And then 25,000 each to Spurwink for the extra work in Lewiston and Needle Point Sanctuary in Wabanaki in Bangor for the extra work with the HIV outbreak. I can say Wabanaki and Needle Point and Coastal, they've all been reaching out since before I started asking about extra money for those different reasons. And then the second option basically takes MIRAP out and gives Coastal the 75 since they don't have any and bulks up Lewiston and Bangor for the extra support they need there with Cozy closure in Lewiston and HIV outbreak in Bangor. So the long and short of it, and then if people have questions, have at it. I'll try to answer.
Maggie.
I know I should know this off of the top of my head because we're one of the recipients. I'm trying to pull up our grants portal, but what is the timeline by which the original SSPs were given the money? I guess I'm just trying to wonder about like when's the next, if there
So
were
all of the original ones are getting their year 2 funds.
Which covers from which date to which date?
Late December to early January is when that'll come. So
in principle, all the new ones.
So this proposed award is just a 1-year award. So basically the 2026 calendar year award in line with where all the other SSPs were.
Okay. And as a follow-on to that, for Coastal and under the ED recommendations, can you go back to that one? By the way, thank you, Chastity, for building these tables. It makes it really helpful. And for thinking through and liaising with the CDC on this. For the, I say like new and caveats, the new ones for Coastal and MIRAP, were they operating for the whole year?
This year,
Yeah.
2025. No, MIRAP Tess can give you, well, they opened when I had started, that was like the first thing that I did as ED was went to their grand opening. They opened the Access Center with their MRC funds for the center. And Coastal, they've been operating for a long time. They used to do syringe service work through HEAL certification. And then when HEAL closed, they lost that. So they got themselves certified. They're a recovery center too. And they currently are still waiting for, they're certified, but they're waiting for funds from the CDC. So they're not receiving CDC funds for their SSP work yet.
Okay. And MIRAP, you said they opened, but when did they launch the SSP specific component? Was it the full year or is it been
Same
like
time. So they just opened in July and they
Okay.
have then.
One way that could be potentially fair, which also depends on timelines for contracts, but is to go with option one, but prorate the amount that's given to MIRAP because they weren't operating for a full year. And give that extra to Spurwink or whoever. To balance that out and make it fair that like everybody who's been operating for a year gets 75,000. But then assuming you're gonna have a renewed 75 in January, like does the contract
So
go for it? Yeah.
yeah, Coastal and MIRAP specifically, all of the SSP money, they get it upfront in their contract. So they get it all upfront and it's flexible for them to spend. So it would be for the calendar year 26.
Yeah. I guess though my point is that I wasn't here when the original 75 was decided. So I assume everybody who was an existing SSP, the 75 was meant for a year's worth of SSP services. So to be fair and not give 75 to somebody who didn't operate a year, you could prorate it and then spread that balance out. But also then like the other factor is, are we gonna renew another 75 in 2 months? And will it take us 2 months to get the contract out the door? In which case, should we just give them next year plus this year at once?
So this would
Pat,
be
go ahead.
only, sorry, I just want to answer Maggie's question before Pat goes. This would be in place of Cozy's year 2 payment. This would be so it wouldn't be renewed. It wouldn't change. If we did option 1, Coastal and MIRAP, they would get a 1-year contract. We'll say January 1 to December 31.
So this money wouldn't cover anything for back now. It would just essentially bring them into the fold for next year.
Yeah, it's just reutilizing that money that we already have set aside and we're planning to give out at the beginning of the
okay.
year
Good
and
framing.
giving it to someone else instead of us holding it when someone could use it for the year.
Yeah, that's a helpful point. Sorry, I forgot that.
It's okay. And then for all of them, even all of our existing ones,
Well,
after
then-
their contract is up, there's
Hmm.
no guarantee there's ongoing funding, period. This is a one-time fund and the council will need to decide what we're doing going forward, which we have to anyways.
Right, it feels like
So it's
maybe as soon as we make this decision, then we start talking about that one, if assuming we're 2 months out from them needing a renewal, or if that's something that the council decides to move forward, which would be a conflict of interest for me, and I wouldn't be able to take in that particular combo. Cool, all
you
right,
can just vote.
what?
You raised a really good point. I think Pat might speak to this. That's why Pat, I was jumping to you. I think that yeah, there's no more money appropriated at at the time. So this is a really important, timely conversation. So Pat, you want to
Yeah, I was just
chime
going to
in?
reiterate that this was full year of funding. This wasn't going back. So this wasn't about that MIRAP or Coastal was a half a year. This is for next year. It's a full year funding. But I think it's the same thing. But the whole grant process has to be renewed within the next year. So we'll be in the second year of most of the grants, and they'll be finalizing. So we'll be reviewing all of them. and including the ones that we did last December that were 2 years. But I was just going to clarify that these were a full year. These weren't a partial year award.
So essentially, we'd top up for a lot of these, except for coastal and MRAP, we'd be topping up the existing funding. But the reality is we're not really topping it up because we're not going to get the contracts out the door until the existing contracts are expired. I'm assuming it's going to take us 2 months to get these out. Maybe not. Chastity, do you have a sense?
So the 3 existing, I think we could just do a contract amendment for their year 2 payment. Coastal and MRAP, we could do contracts, but the SSP contracts, they're all done. It's just, so they'd probably be some of the quickest contracts that we ever actually did. So I think it would be an easy lift in the grand scheme of how the other ones have gone.
I mean, I do like your thinking, Maggie, and I don't know, maybe, to the explanations about that full year, whatever. I do really, I don't know if you're, I just think, I think all the option A folks need money. So it's hard to say. Like, I think we need to figure out how we can spread the money around in those in option 1. And if people like what Chastity's put forth, but I think it's important to have me wrap in the funding, receiving the funding as well.
Yeah, and then the only reason those 2 are 75 is just that was the full year award for an SSP, and neither of them have that. So these 3, it's an additional on top of what they already receive.
So just not to, I mean, I think it's easier to do what you're saying, Chastity, but this is a new kind of game. Like we could decide wherever we want, right? Because we did something in 2023. It's now almost 2 years later. I say that, and then the other side of my mouth is like, but then keeping it consistent has value too. So what's the will of the group around kind of that initial consistent 75 and 75 versus where we find ourselves kind of using extra funds that didn't get spent? Is that clear to people? Clear as mud. Maggie.
I like the principle of consistency across the board as a flat. I think it fits with the capacity. I don't know if I can weigh into this actually.
Yes, you can.
You can.
I just can't vote.
Correct.
Okay. I think given the capacity of MRC and where we're at in terms of the information we get in and all of that, it makes the most sense to keep it simple and just do 75, 75. If we weren't to do it like that, then I think we'd probably need to do it based off of either complexity of the operations, how much is mobile outreach versus brick and mortar, or the scale of the operations. So like tiered percentage based off of client base. And I think that's just really complicated. And so for consistency and getting it out the door, which is perhaps the most important right now, that makes the most sense.
Mm-hmm. Pat.
So I like option 1. And I had seen these before. We talked to Chastity before about this. There's a part of me that thinks, well, we know that there are certain pockets that have struggled. But again, they're getting the most press. So I think that although we know that Lewiston and Bangor have been hit hard and all sorts of things, the other ones are quietly going about their business, and I'm sure that their needs are just as great as the other ones. And so rather than, I think in fairness and looking at it, all knowing that any of these programs will do well with their money, I am going towards option 1 as a fair distribution of money that unfortunately we got because a couple of agencies could no longer be eligible for the money. So I think in the long run, for right now, I'm looking at option 1.
So I think that Tess, probably you're abstaining. And Maggie, you're abstaining. So Liz, you weighed in. It looks like you're supportive of option one too as
Yes.
well.
Yeah, I just think it's like consistent with what we've been doing. And I'm down with the consistency, given that we don't know, we have other things we need to find out, and we can find those things out hopefully in the near future to make decisions for the next time.
Great. Do we need a motion, Pat, or anything, or just what's this?
Yeah, well, I would recommend that you have a motion and a vote because this will go to the full council, but that way we can say that this committee agreed with this recommendation. And then they can vote on it quickly at the next meeting and then hopefully quickly, and then Chastity and Elizabeth can get working on contracts.
Quick question for Grayson. Can the three of us vote and that be enough for the council? Is that enough, given that Maggie and Tess are abstaining?
So
Um, sorry.
all you're voting
Maggie,
on is the recommendation.
Okay, yeah.
And I just want to mention abstentions bring the threshold for quorum down. They don't count
Okay.
against quorum.
Okay. And Maggie, yeah, wait, you
I
can
think
vote
I
on
can
this
vote
one,
on
right?
this.
Yeah.
The thing I can't
Yeah.
vote on is what do we do for
Subsequent.
next year?
Yeah, you can
Yeah.
exactly, Maggie. Yeah.
Great.
I
Sorry
also
to
support
include
option
you
one.
in the. But Tess, we know Tess, you will abstain.
Yep, I will be abstaining.
Okay, so can I get a motion to recommend option one as laid out in the document in front of us, with the five organizations getting a total of 225,000, and we can attach this?
So moved.
Great, Maggie. Second,
I'll second it.
Pat. Okay, Grayson, you want to call the roll?
Yes, thank you. All right. Joe Everett,
Yes.
Liz Blackwell-Moore,
Yes.
Maggie McLaughlin,
Yes.
Pat Kimball,
Yes.
Tess Parks.
Abstain.
Did I miss anyone? No. Okay. Thank you, guys.
Thank you, Grayson. Thank you, Chastity, for putting that together. That's very good, and I think really good direction. Okay, so we're down to the wire in terms of our time, but I keep adding the community needs assessment conversation to the agenda. And I'm wondering if time's a ticking. So will we have the next meeting will be after the public hearing, right, Pat? Okay. So I'd say rather than, I do think in Chastity, maybe you and I can have an offline conversation just about the sources and like, I think we need to sort of like come up with some thinking that maybe we could bring back to the committee, and Pat, you could be part of that. Just to sort of like, there's so much information over the summer when we talked about it. We need someone to help synthesize it. The staff's way too busy. The committee's way, stretched. So I think if we plan on hearing from folks at the public hearing, then we can do some organizing and think about possible folks that could come in and help us organize it. Does that make sense? It's just a lot of work to sort of tackle that. Okay.
Quick
Go,
question.
go
I
ahead,
agree with
Maggie.
you.
Maggie, did you have your hand up?
Chastity, you
Yeah.
can go.
Oh, go ahead, Chastity. Sorry. People are jumping around on my screen. I'm sorry. Sorry about
Did
that.
we or are we? I feel like Elizabeth asked this, but I don't remember the answer. Change the meeting for November where it was Thanksgiving week, or is it staying on its normal time?
I think we'll have poor attendance if we don't change it. And I would almost vote that and we can work on this, Chastity. I think we have a combined December, January meeting, just because the month it's tricky and people are busy and there's so much going on. So let's look at, and I can work with Grayson and you around a possible date and send it out to this group to see if it's doable. But I think that Thanksgiving week is going to be, I'd rather have more people attend. So let's look at, does that sound good, everyone, to have a combined November, December, like maybe into December?
I do.
Perfect. Okay, thanks.
Sorry to interrupt when you're raising your hand politely, Maggie.
It's so hard to find the react button because you're always worried you're just gonna send hearts into the air. I was wondering, can we get on the agenda for the next one, the conversations around the pipeline? I know we were hoping for the financial analysis, but now we are facing, we're facing the increased queries from folks who want to understand, is there renewal for these shorter term grants? And so having a conversation to guide, we're already going to have a gap, which is fine, and there might not be anything. We might choose not to continue funding, but I think we should have some financial analysis by that time, and then it would be nice to tackle at least some preliminary recommendations or figure out what else we need to figure out to get recommendations.
Yes, yes, yes. I think that we spent so much time working on getting these grants out the door that to me that's our key role. That's our relevance, Maggie. So I think getting back to that. So yes, let's prior. I'll put that front and center because I think I'm also as we're talking and thinking about SSP funds and what Pat said, we may not be the committee, the group deciding that, right? As the year ticks by. So I think the pipeline is really important. So I will add that for the rest of our time throughout the next year. That'll be a standing agenda item so we can work on that conversation. And we do need to know where we stand financially, but it's going to be really important to, and we never ever really was able to sort of, if Todd was here, he always talked about like the small buckets of money for, and I'm raising them up, Todd, if you're listening, that it's really important that we, if we could make it, but we just haven't been able to get to that because we have capacity really.
And I think Deb's doing a really good job at putting that budget together. So we really have a clear picture of where we are financially, whether we have extra money or not extra money. And so I think that's a real important thing. And again, tick, that next round of grants isn't that far away. So let's, look at where the process that we had and start making some changes to improve it, and make some decisions whether we're going to do this strictly as 2-year grants, or are we going to extend some of them? I mean, these are conversations that we need to start having.
And the last item that I've been thinking about is sort of, and we don't have to get into it today, and it might not be necessary, but the intersection with school, the school conversation that's happening this week, Liz, your and Maggie, all the prevention work, just I don't have any needs. Just I just want to let people know that I'm open to whatever you need from this group, we're here. So I think that I know that we have some really talented people working on those areas, but if there's an intersection, let us know. Go ahead, Liz.
Well, I was just gonna say, guys, sorry, I know it's like 3 minutes, but the school work group, it's just Melissa and I meeting because we need to meet together to in a
Right.
public way to talk about who's going to be on the committee and what's the agenda going to be. So that again, unfortunately, it's like everything's taking really long on that. So I apologize, and there was things we can't do, but I think there will be some conversation. I think we're also, Chastity and I are meeting with HRA this next week, maybe, or the week after, to really start working on the prevention RFP that's related to the community coalition work. And I think, I think our thoughts were that we would mirror that RFP process to the 2Gen work. So I think we sent them the RFP that we used in the past and the comments and the feedback that we got about that as they start to think about how to guide us on the RFP. So for the prevention work. So, I mean, I think the prevention grants or that RFP, my hope is that goes out before we send out the next round for the other stuff so that, we'll have another round of practice on the RFP practice and like the scoring and getting that right. That'll be much smaller than before we do another. And I mean, that one should be smaller as well, since we'll have some continuing funding that we're giving out. So we won't probably be giving out 50 contracts again. It might be contract renewals or extensions or something. So I'm looking forward to that work with HRA, so we'll keep you all posted. I know they want to have some conversations with the council about what the council's desires for that work. So you'll hear more after Chassie and I meet with them.
That's great. Yeah, and I know that you two are meeting, but you're both really good. And I know you're having a meeting, then you have to make it public, but it's great to get the school stuff talking.
Oh,
You know, you guys, your group of two.
our group of two. Yeah, I mean, I was like, oh my gosh, we got to do this. Yeah.
Yeah.
Because before I was working with Sarah Johnson, who was not on the council, to plan the meetings and stuff from the PTTC. They were offering that for free, so we could
Yeah.
just meet. It hadn't occurred to me that we can't do that with this, and we just made the meeting agendas as we went in the meeting. But anyway, so that's why we've had to go back and do that. So it'll be great. We're moving forward. Moving forward.
Great. Thank you, Liz. Any other business? I think we have a good agenda for next time. We will be bringing the recommendation Chastity's work forward to the council meeting in a couple weeks. If there's no new business, I think we're a wrap.
All right. Thank you, Joe. Thank you, everyone.
Thanks, everyone. Good to see everyone.
See
Thanks
you.
so much. Bye-bye.
Right on time.